And welcome back to the show. Well, throughout the month of May, BronxNet is celebrating National Nurses Month, highlighting nurses who serve the community in a variety of different ways. Whether it's a national health emergency or routine daily care, nurses' vital contributions impact the health and well-being of our communities. Our next guest has been with VNSNY for 17 years, and she spends her days visiting Bronx residents whose doctors have prescribed skilled nursing care and follow-up education for their patients at home. Joining us now to share more details is the registered nurse at VNSNY, Amishika DeCosta. And Amishika, good to have you.
Good. Thanks for having me. Good morning.
Good morning and welcome. And of course, congratulations, National Health Month. And so we want to give you a special congratulations for the work that you do.
Thanks.
So for an average viewer who says, listen, I don't understand what a visiting nurse does, give us a little bit about your day-to-day.
So we typically get patients from the community, whether we get community referrals, we get referrals from the hospital. A patient may have had surgery, joint replacement, any type of surgery, and may need some follow-up education at home. So the doctors would refer the patient to Visiting Nurse Services of New York for continued care. During that time, we come in, we evaluate the patient, and based on our evaluation, we may say that this patient also needs other disciplines as well. But as a nurse, we primarily focus on educating the patient, making sure that the patient is taking the correct medication as prescribed by the discharge summary, and teaching and helping the patient change lifestyle. That might be a diabetic patient that now needs to know to count carbs, to look at nutrition labels to see that, carbs break down into sugars and things are found in, sugars are found in different things. It may not just be a cake. So that's how we spend our day.
What's it been like for you given the fact of this pandemic? Because you already had a hard job to do before. Now the pandemic comes in. What's it been like for you on the front lines?
In the beginning, it was kind of scary because it was so unknown. But VNSNY has did a pretty good job of getting us PPE equipment early on. So we were able to continue to provide care to the patients in the community, especially the patients that were now coming to us COVID-19 positive. So it was a lot to doing on and off all that PPE equipment out in the field. But we were still able to provide stellar care.
Yeah. Was there a lot of fear on the part of the people that you came in contact with on a day-to-day basis? I mean, as the virus progressed, I think more and more of us started wondering, asking questions, particularly in New York City, where the numbers continue to rise.
They did, and some patients in the beginning didn't want services because they didn't want anyone in their home. So we did have some patients who refused services in the beginning because of the uncertainty of this virus. And they just didn't want any new, any person that could spread the virus in the home.
Yeah. So give us a little bit more of an inner perspective, if you will. So before COVID, you're doing this, you're going to the house, you're visiting. Now you've got COVID, and of course you're talking about PPE, you're talking about social distancing. How does your job change, and what kind of adjustments did you have to make on the inside, given the fact that COVID was now in the community?
We adjusted by now, like trying to keep a certain distance from the patients and not sharing our equipment with the patients. So now we went and allowed the patients to sign our tablet because to avoid, contact. And now when we go into the home, the patients would need to wear a mask as well.
And so now they're being on the other side, pretty much. And when I say the other side, hopefully we are on the other side. What's it like now going into the home? Is there a little bit more ease on the part of your patients? And is there a little bit more ease for you as a nurse?
Yes, it's a little ease all around. We feel like we got through the worst of it, So the patients are a little bit more trusting again and willing to have us in the home to give them the care that they truly need.
And as a nurse during these times, particularly, the pandemic, has this brought you guys a lot closer together as nurses, given the fact that we were in a pandemic, and it seems like with you being on the front lines, the brotherhood and sisterhood just tightened up a lot?
Yes, because no one else but another nurse understood all of what we were going through and the uncertainty of this all. So yes, we had conference calls where we would talk. VNSNY also gave us emotional support as we dealt with this on the front line. So yes, it brought us closer.
And so for you being a nurse, talk to us about National Nurses Month. What does it mean to you to be recognized as a nurse in a time like this?
I think it's awesome. I think it should be National Nurses Year. We do good work throughout the year.
All year long, I hear that.
So,
And so what is it that people may not understand in the life of a nurse? Take us through the life of a nurse that, like you said, only a nurse understands a nurse. What is it that maybe the public doesn't understand about your work, your workload, and what you got to do?
as a home care nurse, we deal with a variety of different patients. So you have to meet that particular patient's need, and that may not be the need as the patient you saw before. And not only by meeting their needs, you're meeting them at where they are, right? In their disease process or whatever it is, their surgery process, it's meeting them where they are and trying to provide that care that they need at that time to help them to get to the next level of recovery.
And for you, how rewarding is it to see the fruit of your labor right now? I mean, obviously being on the other side of the pandemic, but really navigating people through this time. And we understand nurses are sometimes that stabilizing force in the lives of your patients. And your patients have had a rough time. And now we're getting a little bit better out of it. But what's it been like for you, that feeling of actually navigating your patients through the season?
It's been rewarding. As a nurse, we've also been a therapist because throughout this pandemic, they've spoken to us about their fears and concerns. So it's been truly rewarding.
That's so well. Thank you so much for being with us and sharing. I mean, honestly, the work that you guys do is tremendous, and especially going out into the field and visiting. And sometimes the conditions may not be the best, but yet still you make the best of a bad situation. Thank you so much, Amisha, for the work that you guys do.
Thank you. Thanks for having me.
All righty. Well, I want you to know that if you want more information, all you got to do is visit the Visiting Nurse Service at their website and then also on social media as well. Okay, we are taking a quick break. We got more show. We want you to stay with us. Open returns coming up right after this.